All right, good afternoon and happy Friday because according to my calendar, it is in fact Friday. As for every other day of the week, remember your microphones, and if you don't send video, we're going to see the wrong face on the panel, and we don't want that to happen. Yesterday, the Secretary General brought together the principals of the 31 UN systems entities in a virtual meeting of the UN Systems Chief Executives Board, otherwise known as the CEB. This is the long-standing and highest-level coordination forum in the UN system. The Secretary General gave an overview of the state of the world, reflecting the future of multilateralism beyond the immediate response to the COVID-19 pandemic, as well as on the risks brought by the current crisis for human rights, global governance, ethics, and international cooperation. A couple of updates to share with you in response to the support provided by our peacekeeping missions in Africa. In the Democratic Republic of the Congo, as part of its support to authorities in the Kasai Central Province, the UN mission installed containers in the central prison located in Kananga. The containers will be used as quarantine quarters for detainees with suspected cases of the virus. The peacekeeping mission has also supported the central prison in other ways, including by providing staple food items. And in the Central African Republic, the UN peacekeeping mission there says they have launched a COVID-19 sensitization campaign in Bria. The campaign involves motorcycle taxi drivers who deliver messages megaphones. The UN mission has also conducted media training for journalists from local radio stations on coverage of the pandemic. This included tips to help prevent the spread of rumors and disinformation. The UN mission in Mali has provided prevention kits that include masks, soap, hand sanitizers, and laser thermometers to commanders of the reconstituted armed forces. Radio Mikado, the radio station operated by the UN mission, has shared virus prevention messages in local languages and sensitization radio programs with over 63 local radio stations across the whole of Mali. Working in partnership with an international NGO in the Mopti region, our peacekeeping colleagues have also conducted awareness-raising activities and distributed hygiene kits to a school. The mission also installed public hand-washing stations at the school's entrance. Turning to Lesotho, while the country has only recently registered its first confirmed cases of the virus, the UN team on the ground, led by the resident coordinator, Salvatore Nyonzima, has been supporting the government's efforts in addressing the pandemic in areas of public health and the economy. The UN AIDS program is also helping in setting up systems and guidance for surveillance of COVID-19 cases and contact tracing. UNICEF is helping the government to spread information about the virus over the radio and on social media. The UN Population Fund, for its part, is focusing on preventing and addressing violence against women and girls, and the UN Development Program is redirecting resources to address the immediate socioeconomic impacts of the pandemic with the government and its partners, and that includes the World Bank. COVID-19 has also resulted in a migration emergency in Lesotho, as well as its neighbors. The UN Migration Agency is assessing the plight of migrants returning to Lesotho, with many people living on the border with South Africa needing food, shelter, and obviously medical attention. And we've had several updates on the deteriorating situation in the Sahel. And in a joint statement issued by 8 UN agencies and NGO partners working across the region, they say that the crisis is now affecting the highest number of people ever recorded. The group warned that 24 million people, half of them children, currently need life-saving assistance and protection. The deterioration of the security situation has also led to ever-growing numbers of displaced people within their own countries and across borders. Rising hunger, inequality, and the direct and indirect consequences of the COVID-19 pandemic are compounding this crisis. This includes a reported rise in gender-based violence, and there are also 4.5 million internally displaced people and refugees in the Sahel. 12 million who are there are 12 million people who are food insecure at crisis and emergency levels, and 1.6 million severely malnourished children. 8 agencies aim to provide assistance to 17 million people and require $2.8 billion to do so. So far, only 18% of the amounts have been received. And in Nigeria, our humanitarian colleagues tell us that aid services will resume for 42,000 internally displaced people who are sheltering in a secondary school in Mangala in Borno State. Humanitarian assistance was suspended for a month after an attack against an aid worker. Yesterday, there were meetings to ease tensions between displaced people and humanitarian partners who are providing food, shelter, water, sanitation, health, and psychosocial support, among other services. Aid workers have also been trained on virus prevention measures, and they are setting up hand washing stations across camps in Borno State, as well as quarantine shelters. And we have an update on the humanitarian efforts to ensure life-saving equipment, medicine, and personnel reaches those who need it in every corner of the world. Today, the World Food Programme launched international passenger air service to bring humanitarian and health workers from Ethiopia to Tanzania. The flight was the first of its kind since commercial air services were suspended in Tanzania as part of the country's efforts to curb the spread of coronavirus. The passenger air service is part of WFP's global system to provide logistics support for the pandemic response. As we mentioned a few days ago, WFP's air bridge system is based on global humanitarian response hubs where supplies are manufactured in Guangzhou, China, in Liège, Belgium, and in Dubai in the UAE, and regional hubs in Ethiopia, Ghana, South Africa, Malaysia, Panama, and Dubai. Flights operate between the global and regional hubs, and a fleet of smaller planes moves cargo and humanitarian staff into specific countries such as Tanzania. Once the service is fully operational, WFP, which runs the air service on behalf of the UN, expects to maintain regular flights to key locations around the world. In Tanzania, flights for humanitarian and health workers are expected to take place every week. And in Bangladesh, we, along with our partners, have stepped up the responses to COVID-19 in Rohingya refugee camps in Cox's Bazar, following the first confirmed case there of the COVID virus. In addition to one Rohingya refugee testing positive, one member of the local Bangladeshi host community has also tested positive. UNHCR says there are serious concerns about potentially severe impact of the virus in the densely populated refugee settlements, which are sheltering some 860,000 Rohingya refugees. Another 400,000 Bangladeshis live in surrounding host communities. These populations are considered to be among the most at risk globally in this pandemic. For its part, UNICEF is preparing specialized treatment centers with 210 beds while providing personal protective equipment in Cox's Bazar. UNICEF is also supplying safe water and soap for 240,000 Rohingya refugees, more than half of whom are children. The World Food Programme, for its part, issued an urgent call for $320 million to provide food and cash transfers to the most vulnerable families in Bangladesh in the midst of the pandemic. At food distribution sites in refugee camps, WFP is ensuring physical distancing. It is using loudspeakers in camps to circulate information about food distribution and virus prevention strategies. WFP is also continuing to prepare for the approach of the monsoon season, which could further complicate the current situation. Last year, more than 4,000 refugee families were displaced in a 24-hour period during one of the heaviest downpours. And in Belarus, where there are more than 25,000 confirmed cases of the virus and nearly 150 confirmed deaths, according to the World Health Organization, the UN team led by the resident coordinator, Joanna Kazana, is supporting the government's efforts to ensure access to health services and social protection, particularly the most vulnerable people. UN migration agencies and UNHCR are stepping up services and cash assistance to migrants and refugees and are setting up an information hotline. UNICEF and the UN Development Programme are supplying thousands of liters of disinfectant and antibacterial soap, as well as gloves and masks. To address social exclusion, the UN Population Fund and the Red Cross Society have joined forces with a local tech company to encourage and coordinate volunteers to help older people during the pandemic. And a note on Central America, where UNHCR today warned that escalating violence and insecurity, coupled with COVID-19 related restrictions, is exacerbating hardship for tens of thousands of people in the region. As of the end of last year, Violence has forced some 720,000 people to flee their homes. Almost half of them are now displaced within their own country, while others have fled across border. Today marks the International Day of Families. The day provides an opportunity to promote awareness of issues relating to families and to increase the knowledge of the social, economic, and demographic processes affecting them. This year, this day comes at a time of one of the most challenging global health and social crises. The COVID-19 pandemic brings into sharp focus the importance of investing in social policies protecting the most vulnerable individuals and families. The UN added that it is the families who bear the brunt of the crisis, sheltering members from harm, caring for out-of-school children, and at the same time continuing their work responsibilities. And at a time where some of us are away from the families and others are spending a lot of time with our families, it's a very important day to note. Okay, I think I've spoken enough. Let's hear from you. Evelyn.
Thank you, Stéphane. Good afternoon. Several NGOs have asked the UN to call for the postponement of elections in Burundi, which is harassing opponents, thrown out WHO, is clamping down on the media and so forth. Any reaction, please?
Well, we're obviously, you know, first of all, it is the sovereign right of Burundi to set its date for its elections. Various parts of the UN system have expressed their concern about the political situation we have, as well as the World Health Organization and the International Commission on Burundi, notably on on the lack of public health measures that are not in place during this election. Edie.
And and Cox's Bazar, has there really been testing? It seems like whatever number the UN comes out with, very, very low.
Well, I mean, this was the first report. One member of the refugee community and one member of the local host community having been tested positive. It may be that there are other cases, but obviously this is of concern. I think, as I've just underscored, the UN system there is fully mobilized to stop the spread and mitigate any impact that it will have. Edie and then Majid.
Thank you very much, Steph, and happy almost weekend, if weekends mean anything these days. The Fifth Committee met this week, and I wonder if you could confirm some figures that $1.63 billion is owed to the regular budget as of May 14th and $2.14 billion to the peacekeeping budget. And I wonder if you could also give us the figures of how much the United States owes.
Sure. Let me see. Yes. Let me get some detailed figures. Let me get some detailed figures on that. I mean, what I know is that as of May 14th, the total unpaid assessments under the regular budget and the peacekeeping budget amount to about $1.63 billion unpaid in the regular budget and $2.14 billion US dollars unpaid for peacekeeping. I'll see what other figures I can share with you.
Yeah, I'd like the U.S. figures, since I'm assuming they are the biggest at the moment.
Yep. Majid.
Thank you, Stéphane. I have a question on Syria. It's a bit a long one. I need to explain it. According to a report by our foreign policy colleague, Colin Lynch, the UN and the WHO will no longer fund aid organizations that deliver food, medicine to millions of people in need in the Kurdish northeastern Syria, unless those aid organizations get permission from Assad regime, which is, as you know, it's almost impossible. So no aid if you don't have the blessing of Assad regime. Regardless of political excuses, which I'm sure your humanitarian partners have a long list of, the UN is practically enabling Syrian government and Russia to starve millions of people to achieve their political agenda. Isn't that an accurate description from what's happening right now?
No, I think what I can tell you is that what we are doing through our cross-border work, which was reauthorized recently, we are doing whatever we can, and I think the host. I mean, we're updating you regularly on the number of trucks that go through. We're trying to reach with our partners everyone who needs to be reached in that area. We're also working.
Isn't accurate? The foreign policy report. So those 8 organizations in northeastern Syria. What I'm telling you. But
Majid, it's hard to do a back and forth on this on this platform. Okay. Is what I can tell you is that I think the basic premise of the article was false, and that we are doing whatever we can to help everyone in Syria who needs help.
Just to follow up, Stéphane. So you're saying that the aid organization, in order for them to get funding from the UN, they do not need to get permission or license from Damascus. Is that what you're saying? Because that's the premise of that.
What I'm saying, the article said that we had given legal, we had received or shared legal guidance that agencies could only provide with funding to NGOs that operate in northeast Syria with the approval of the government of Syria. What I can tell you is that we did not seek, receive, or share any legal guidance to that effect, that UN agencies could not fund NGOs that provide cross-border assistance. Philippe.
Yes, hello, Steph. Question on budget too. How much do you spare each month with an empty building?
Well, it's a complicated situation, like everything with budget. I think our handling of the current pandemic has obviously meant that we're saving money on some expenses, while at the same time we have to deal with some new and unforeseen costs. So clearly on issues of movement, travel restrictions, it's meant that we are seeing some reductions in the number of official business travel of representatives. There's also been a reduction in the hiring of experts and on general operating expenses, such as utilities and so forth, and no doubt the escalators for James's use. And at the same time, we have some additional expenses. So we're increasing some of the ICT infrastructure, video conferencing, the computers, everything that we need to do our work remotely. The increased telecommuting has put pressure on all of those demands. In some places, we're seeing additional funding demands for quarantine facilities, as well as medical supplies and equipment and so forth. So we can in a sense, it's not as if this pandemic is saving us a lot of money. So at the bottom line, we're saving money in some, but increasing money in other quarters, notably on IT infrastructures and health medical supplies and so forth. Iftikhar had a question that he's written in. Does the SG support the call made by 140 world leaders for the eventual coronavirus vaccine should be free of charge for all? I think what is important, and I think the Secretary General made it very clear in his remarks to the Brussels meeting, is that this vaccine should be a global public good. Okay, any other questions? just as a matter of business, housekeeping matter, we may be switching over the next week to a WebEx platform, which will allow more interaction. We'll be in touch with you guys. I think we'll need to do a test session, but we did a test internally yesterday, and it works better than this platform. We can all be in the same room, virtual room that is. So we'll keep you posted on that. Unless Florencia tells me to stay on, I will wish you guys all a great weekend. Thank you.